This is an inspector in the New York City Police Department. Good man. I've known him for quite some time. Unfortunately, because of the riots and all the problems, he had to continue working even though he had this pathology, including this cartilage injury. He said, I just have to keep working. I can't let my officers down. And he got re-injured, and I'm just really proud of what he's done. This is the outside. Look at all this damage. It's basically almost bone on bone, but he's only 55. So we clean up these degenerative meniscal tears, and he has to be told that the next step is a knee replacement. The problem is he's only 55 years old. So to me, that's young to have a knee replacement. So the longer he can avoid it, the better. And we just, do some limited dose procedure. We clean it up a little bit, get him moving a little bit. Maybe this will give him a couple of years where he feels great. He may need some injections as well of cortisone or PRP or stem cells. We'll see. But a lot of these procedures, they're not curative, and it's important for the patient to know that. This isn't curing it, and I told him that beforehand, but if it can give him some relief, and all we did was make a couple little holes, it's just very inconvenient. It's safe. Anesthesia is real safe these days for healthy patients, of course. And, he was thrilled. He understood what his options are, and he went with it. And we'll tell him the news and hold off on a knee replacement as long as we can. Hopefully he gets a good 5, 6, maybe even 10 years before he needs a total knee replacement.